More than 107,000 Americans died of drug overdoses last year, setting yet another record in the nation's overdose epidemic. Alabama saw a 30% increase in these deaths, while nationally, according to the CDC, overdose deaths increased 15% from the previous year. Last year, the state of Alabama had a reported 1,286 deadly drug overdoses, up from the 989 reported in 2020. The number of non-fatal overdoses increased 38%.
Dale Jackson here for Yellowhammer Now. Let's talk a little bit about some good news for the state of Alabama. Yes, it comes on the heels of news during the pandemic that we saw a lot of people losing their lives to overdose deaths. Well, it's down a lot here in the state of Alabama, and there's a pretty easy to understand reason why.
Federal numbers show that overdose deaths in Alabama have plummeted by 30%. According to AL.com, the state saw that decline from March 2024 to March of this year. That decline is a sharp turnaround from 2 years ago when, according to the CDC, Alabama was one of only 6 states with the rate of drug overdose deaths increasing. The national average was a 26.6% drop.
Well, the reason for this is pretty simple. We have real, actual attempts to curb this epidemic that has been killing people in this state and beyond. We have more access to NARCAN, which saves people in the moment when they're having these overdoses. We have more rehabilitation and more treatment than we have ever had before, which is why it's kind of troubling to see that we have a group like Bradford that does good work, helping people all over the entire state of Alabama, looking at stopping other people from opening up clinics that could help people treat their addiction and their illness. But that is exactly what is happening. Longleaf Recovery and Wellness wants to open up a facility in Shelby County with 60 beds that will clearly help more people in Shelby County. They want to open up this facility, but they're being stopped by Bradford. Now, Bradford could only be trying to stop them for one reason and one reason only: financial reasons. Reasons that could affect their bottom line, and I don't even hate them for that. This is obviously something they have to worry about when you're running facilities. But for the people of the state of Alabama, the more treatment available, the better. We've seen it. We have a 30% drop in overdose deaths, and we should drive that number lower. Hopefully the people involved in making this decision will reject this objection, let this recovery center open, and let more people be treated.